Welcome back to our program, and we're talking with ear, nose, and throat specialist Dr. Frank Brettschneider, and we're talking about sinusitis. Dr. Brettschneider, I want to start a little bit in this segment about kids, because do kids get sinusitis?
Oh, all the time. I mean, see mothers walking around with Kleenex boxes.
All the time.
All the time. Blow your nose. They're always draining. It's a very common condition.
So how do you treat kids?
Kids are a little different than adults. Kids have multiple other things that occur. First of all, a lot of children are immunodeficient. Their immune system hasn't developed well yet. They deal with food allergies a lot. If they're allergic to milk or allergic to soy, sometimes changing their diet can help. And sometimes they get heartburn and reflux disease. Sometimes they have kind of a weak sphincter to their stomach, and they can get acid that goes up into their nose. That can be problematic. So sometimes allergy workups also are helpful generally. So we have that segment, but we also have some great surgical options for kids. Removal of their adenoids really helps quite a bit. A sinus wash helps quite a bit. And then we do balloon sinuplasty, where we balloon open their sinuses, and that's very helpful also. So we have some great options for kids, but they require a little bit of a kind of a different approach.
Well, that's really helpful to know, because you just think that it's a natural state for kids.
Right.
They've got all this going on.
Right.
Well, I want to talk about adults then, and about surgical treatment options for adults. What are they?
Well, surgery's changed dramatically, especially when I started training in the 1980s. We advanced in the early 1990s into endoscopic sinus surgery, which was done all intranasally with endoscopes. And then from there, we've advanced to image-guided, where we do the intranasal surgery with a CT-guided system where we can watch the instruments go into the nose and sinuses and guide our placement for safety and completeness of surgery. And then lastly, over the last couple of years, we've developed balloon sinuplasty. Great technique where we insert a gentle guide wire into the sinus. It's followed by a catheter with the balloon. We inflate the balloon, deflate the balloon, pull it out, and the sinuses are open. And that's done without cutting, minimal bleeding, no nasal packing, sometimes even done in the office under a local. And then we have some implants that we can place in there that deliver a drug that's a dissolvable stent type of implant that helps their surgeries become more successful.
All right, I want to talk to you a little bit more about each one, because those are really hopeful to someone that is suffering from chronic sinusitis. And so the image guided, is that done in the hospital, or is that done in the office?
It's only done in the hospital, and McLaren Port Huron is the only hospital that has that system available. It really makes the surgery very safe, and it's a three-dimensional screen where we can watch our instruments as it guides into our sinus. So if we're removing polyps or cancers or tumors, it allows us to be very complete, and it allows us to see where our instruments are in relationship to the structures of the head and face.
And so are the results better, I would assume?
Much better. Very thorough polyp removal can be done this way. Cancers, tumors, other growths can be removed in a very thorough fashion.
All right, then let's talk a little bit about how do you do the balloon sinuplasty?
The balloon sinuplasty is a great technique. It can be done in the office, or it can be done in the hospital, or sometimes it's done as a hybrid with standard endoscopic surgery, depending on what the patient has.
Do you have animation of that for us?
We do. Let me show you on the screen here. So this is an animated, this is an Acclarent balloon system. There's another one called Intellis. They're pretty similar. So we freeze the nose if it's in the office or the person's under an anesthetic. We insert this very gentle lighted guide wire, and the guide wire helps transilluminate the sinus so we can see where it's placed. So the light goes through the skin and we can see that we're in the sinus. And then we propel a catheter with the balloon on it into the sinus itself. And this is the catheter. We'll then place the balloon right where the sinus opening is, and then we'll inflate the balloon, which kind of remodels it and kind of pushes it open, and that opening is then permanent. We then withdraw it, and then you're open. And you can see there's no cutting involved. We can also then place a catheter with the irrigant, and we're washing the sinuses out. We're getting all the secretions out of the sinuses. It's a nice way to flush all that stuff out. And now the person has at least a 7 millimeter opening. Everything's cleaned out and then that sinus remains open for better function. And that can be done in the frontals, in the maxillary, in the sphenoid sinuses. This is just a demonstration of us utilizing it in the right maxillary sinus.
So, Dr. Brettschneider, I see that you have a balloon device with you. Can you show that to us?
Yeah, I brought one along so we can demonstrate what this looks like. This is the Clarent device, and let me show you how this works. This is just a simple handpiece that contains a guide wire and the balloon. So we would numb the patient's nose or they would be asleep. This is the guide wire here that's lit at the end, and it's a very soft guide wire. And then after we go into the sinus with the guide wire, then we pass the balloon into the sinus, and then what we'll do is we'll inflate the balloon, and you can see the balloon inflating
oh, yes.
as it fills, and then the balloon is about 7 millimeters in size. We would then deflate the balloon, and then we would withdraw it into the device and then bring it out the nose. And I would have an assistant that would be doing the inflation while I held the device. But very gentle guide wire. I want to stress that this can't penetrate into anything, and it's just very gentle.
Yeah,
so the patients tolerate this very well.
That's fascinating. How long does that last?
It's a permanent opening.
Really? So it's the symptom relief is immediate?
It's immediate and it's long-lasting. The balloon sinuplasty results are as good as standard functional endoscopic sinus surgery results. And of course, complications are extremely minimal.
So to get to that point where that would be a benefit, you have needed to try all of the, because I'm just
Absolutely.
thinking permanent, permanent, no more sinus infections.
This is indicated for people who get recurring acute sinusitis. So if you're getting 4 or more cases of sinusitis in a year, this would be indicated. This would also be indicated for a chronic sinusitis that lasts beyond 12 weeks. So those are the major indications for this procedure.
So would it be fair to say you're not going to get another sinus infection? Or are they just shorter and because the opening is better?
Our goal is to get you like everybody else.
Okay.
You know, everybody may get a sinus infection every year, 2 or 3. We're hoping to make you like the average normal person. You may get a sinusitis, but the chronicity of it, the recurring sinusitis should be much improved.
Great news. Well, we're going to take a break and then come back and talk some more about surgery.